Well, thank you so much, Simmone, for being on the podcast.
Thanks for having me, Erica. I'm so happy to be here with you.
Yes, so I would love for you to share with our listeners a little bit about yourself and what you do.
My name is Simmone Taitt, and I'm the CEO and founder of Poppy Seed Health. We connect pregnant and postpartum people with doulas, midwives, and nurses, all via text message 24/7. And Poppy Seed Health really came out of my own personal experiences. I just recently have started to accept the term in my own life with being on an infertility journey. It's taken me quite a while, I think, to get there. And it started back in 2016 when I had my first of what would become multiple miscarriages. But it was that very first experience where I was in, early pregnancy, and very excited to be pregnant. And I went in for my second appointment and there was no heartbeat. And at the time, I was seeing one of the top OBGYNs in Manhattan, where I was living. And she, couldn't really look at me. And she just said, well, your body terminated the pregnancy, which was a dagger through my heart. And she said, but it's fine. It happens all the time. It's normal. And I'll see you in a couple of months when you start trying again. And she left the room. And I was devastated. I was crying and shocked, and as you can imagine, in tears and gathering my things to leave. And it was first thing in the morning, because I had that appointment right before work. I wanted to be able to get into work on time. And I remember leaving the room I was in, and I turned to the staff on my way out and I said, is there anything that I need? And what I was asking was, is there anything that I need, medical follow-up, like anything? I had never been pregnant before. I had never experienced a pregnancy loss. And so they looked at me and they said, no, we'll see you soon. And so I left that office with no medical, emotional, or mental health resources. I left that office with no follow-up. And for everyone who lives in New York City, I am sure you've had a day where you've passed someone on the street who's crying their eyes out and trying to figure something out. And on that day, it was me. And I did the best thing that I could think of for myself. And I went to the internet, because I went looking for answers, right? I just didn't have any capacity in anyone in my life that had ever shared with me that they had a miscarriage or a loss. So I was truly at a loss for myself. And what I found on the internet within just a couple of minutes, was two important things. The first, a blood test that would show that my HCG levels, the pregnancy hormone, was actually dropping, because my body hadn't caught up with my brain. And my body was also not doing any of the things that I had seen on TV, right? And which at that time was just a lot of blood, and none of that was happening to my body. And so I actually was in a bit of devastation, but also in a bit of denial. I thought my doctor was wrong. And a simple blood work would show that I was actually no longer pregnant, or that the HCG levels were actually dropping. And then the second thing that I found was I needed a sonogram, and two very simple things that weren't offered to me. I picked up the phone, I called my own care plan back into my doctor's office. And it was within those moments that a real fire started to build in me, because I had been taught, right, my entire life that our doctors and our providers know best for us, and to trust them with everything, and to also do exactly what the doctor says, right? And there are plenty of amazing doctors out there. But for me on that day, I felt neglected. And I spent the rest of that day trying to figure out what I was about to go through. From a physical standpoint, I spent the rest of the day looking to feel better. And I think that's a very universal experience, the feeling better. And when it happens. And for me, the feeling better was an emotional connection that I was missing. It was that emotional and mental health support. And so by that evening, I had actually decided to go into work, which we can talk about, which is like, an awful decision to have to make in the moments that you're trying to figure out what to do as your next step. But that evening, I was on my couch by myself alone in my home, and I stumbled onto a doula board. And I'm dating myself here because this is back in the day. It wasn't interactive. It was like a forum, right? Someone would post a question and people would answer. And it was a doula board, and they were answering this person. And for the first time all day reading through that thread, I felt seen. I felt heard. I didn't feel invisible. I didn't feel as isolated. And I started to really melt into that feeling of feeling better. And it was in those moments that I realized that I shouldn't have had to spend the 12 hours that day searching to feel better, right? That it should have been readily available for me and to me. And although I felt very alone in those moments, I knew that I wasn't. And also at that point in my career, I had spent about 12 or 13 years building early stage tech startups, specifically building products for women identifying people who we were empowering to make decisions about their lives, their, family decisions, their health, their wealth, their groceries to their front door. And so I knew the power of creating a product and creating technology that would instantaneously be a solution for someone to have at their fingertips, right? That was looking for, like me, looking to feel better. And I put that together really quickly. And this was back in 2016, because I knew that the power of leveraging the human connection, right? Which for us are advocates, doulas, midwives, and nurses, and also connecting those people with the person that needed them the most, right? In the moment, the same way that I did, was where the real healing and capacity for compassionate care would come through. And so 2016 started my own personal journey on what I call a very complicated journey to parenthood. And the truth is, I don't know if I'm in the middle of it, if I'm at the beginning of it. I do not think that I'm at the end of it. I think I would say that I'm really deeply into what my own healthcare journey is looking like today, and what my own fertility journey is looking like today. And, if I were to fast forward to where I am now, that was 5 years ago. But between these 5 years, I've been diagnosed with adenomyosis. I've been diagnosed with stage 4 endometriosis, of which I had very major surgery for at the beginning of this year. I've discovered holistic ways of caring for myself in collaboration with the medical side. I've had 3 miscarriages and 3 pregnancy losses, and all sorts of other kinds of losses, actually, within these last 5 years. I've experienced all of this with the best health insurance, with no health insurance, and with marketplace health insurance. So as I'm figuring out my own journey, I think it's so important to share with others, and also to be learning from others as well.
Absolutely. I love that you just are transparent about where you are now. Like I think that a lot of people who have been diagnosed with endo is such a tricky diagnosis, because it's still a learning process for a lot of our providers where they may not know how it looks, and it shows up differently in so many women. So it's good, I always commend people who actually have a diagnosis, because it's so hard to get there, right? To the point of diagnosis. So now you have this, and now you are journeying through, what does this look like as you go throughout fertility. What I also love is how you have really turned this painful moment and really merged it with your career and now have started this app to really connect people with culturally competent information. So people aren't leaving the ER or their OBGYN in office or their reproductive endocrinologist and feeling, defeated and helpless and lonely on their journey. So I would love for you to talk about just the transition from, you know, um, actually going through loss, and then really put in the efforts that you have to really get Poppy Seed Health up and running, because it's hard. It's hard enough to
It
go
is.
through this,
Mhm.
get all the diagnosis, go through multiple losses, but then to start a business on top of all of this is like mind blowing. So I would love for you to just talk about how that journey has been for you, and how you really have taken your background and your career and merged it with this passion project and really your own personal intimate journey through fertility.
Yeah, Erica, I think that for me, it has been parallel paths. Everything that I've experienced for myself, I've put into Poppy Seed Health. My own lived experiences, and I truly do believe this, that when there's not a solution out there, when you're not finding what you need, um, if you can create it, uh, it can't, and it couldn't just be just for me, right? It had to be for the 1 in 4 birthing people that will experience a loss in their reproductive years. It had to be for the 1 in 8 people that will experience infertility, right, in their reproductive years. And so many more, right? Like in the US, our birth rate is just under 4 million people. And when we look at the birth rate and we see the mortality and morbidity rates for Black women and women of color, but very specifically Black women, I couldn't create something that was just for me. I had to create it for all of us, right? And my own parallel paths in trying to figure out my own journey to parenthood. Um, I'll take you actually back to when I got my diagnosis for adenomyosis. So I had just come out of I think I actually was at the tail end of it, a fairly contentious divorce. And that was a really tough time for me. But during during that procedure, so during the time that we were going through our divorce, I didn't have health insurance. And so he actually cut off my health insurance twice. And that second time, I wasn't aware. And I went to the doctor because I was having incredible pain. Erica, is it okay for me to use some terms? Okay. So I went to the doctor's office because I was having incredible menstruation pains. I mean, the kind of period pain that I had never actually experienced before. I had just turned 35 years old, and it was on my 35th birthday. I went out for a run, and I have this abdominal pain happening, and I couldn't figure out what it was. Came back to the house, and I realized that my period started, and I didn't put the two together because in all the time that I had my period, from the time that I was 13 years old when I started my period to 35, I had never had a period cramp. And I had friends who were joining me for my birthday, and they came around, let's say, noon that day. And so I had been in this pain from about, at the time I woke up in the morning, 7 a.m. or so, until they arrived. And I didn't have health insurance. And I said to one of my girlfriends, I think I have to go to the emergency room and I can't afford that. And I, like so many people without health insurance, had to make a decision between how bad is this pain? Is there something else I could do? Is there tea? Is there just a hot water, whatever it is, versus going to the emergency room, because I actually thought that maybe my appendix had burst. Like, that's how incredible my pain was. And she said to me, my friend said to me, well, describe your pain. So I'm describing it to her. And I said, and then on top of that, I just got my period this morning on my birthday. She goes, I think you have cramps. Why don't you take these to Aleve and see how you feel in like an hour? Okay. So she gives me these Aleve, and within an hour or so, I feel so much better. I just figured that month, I said, okay, I've spent my entire life without having any pain, really no PMS. So I guess it's just my time. Welcome me into the club of pain, right? And I went from taking a few Aleve every menstruation to taking an entire bottle of pain relievers within a year of that first pain period. But that entire year, I had no health insurance. And it got so incredibly painful for me. So the pain and also the clotting, and people don't love talking about this stuff because, first of all, it's really intimate. It's hard to be vulnerable. But I also realized that because we don't share our symptoms or what's really happening with our bodies, we're not finding the answers that we need. And we're just tolerating the pain. And so by the year mark, I had actually been with a different friend of mine, and I had my period. We were traveling. And at that point, I went from, using regular, maybe super tampons for the whole week, just a box. I was going through 3 boxes of ultra tampons, which is the heaviest flow. And all of the things that I needed to travel. I mean, half of my suitcase was actually period accoutrements, right? And just bottles of pain relievers. And she looked at me and she said, Simmone, this is not normal. And as soon as I got back to the States, I made an appointment. I, sacrificed what I needed to pay the out-of-pocket cost, which I believe was like $200 to get to my doctor for a checkup. And I got my pap smear and I said, this is what's going on. This is why I came here. And she said, we're going to schedule you for an intravaginal sonogram. It was my first intravaginal sonogram I had. And I remember asking her, how much is that going to cost me? She told me, and I said, well, I can't get one for about 3 weeks. Right. And I went into the doctor to get my sonogram and got the diagnosis about 3 days later that I had adenomyosis, which most people don't know what adenomyosis is. But adenomyosis is the thickening of your uterine lining. It's when blood really gets trapped, for better use of the non-medical terms, between your myometria. So your myometria and your uterine lining. So for people who want to get pregnant, we all go through our cycle, and we really want that endometrial lining and your uterine lining to get thin and then thicken, right? Then you have a period and then to get thin. Mine never actually thins out. So I got that first diagnosis. And I think it was that very first diagnosis, getting adenomyosis, where I knew that I didn't have the resources to turn to the medical side, which was all saying, hormonal treatment, getting on birth control, but that only covers the symptoms, right? You'll never really figure it out, versus looking at a more holistic wellness standpoint. And I kind of just did the math, and I said, I could find an acupuncturist healer who works on people who have these issues, right? Change my lifestyle, change my eating habits, and really go down that route, more traditional Chinese medicine versus being on the medical side of things. And that's what I decided to do. And it took a tremendous amount of research on my end to be making decisions for my body, what would then become my fertility future, for my pain level and for my wellness. And I actually believe that getting that first diagnosis was the reason why I was able to really focus on what bodily autonomy means for me, and then also be able to start thinking about poppy seed health, which didn't even have a name yet, right? It was a concept. It was a concept where I knew that I was going through my own journey as it related to my reproductive health, but I really didn't have the emotional and mental health support that I needed. But I knew that I had the drive and the motivation to try and figure it out for myself. And I think those two things coming together really help with poppy seed health, because I understand firsthand the journey that folks are going through when we're trying to figure things out. It doesn't matter where you are on the spectrum of access or having health insurance, or the finances or the socioeconomic status. It doesn't quite matter what your situation is. We all need that emotional and mental health wellness, right? And that emotional and mental health support. And those resources, they really started with that first diagnosis with adenomyosis, but it allowed me to continue to, I think in a very healthy way, continuously question, any other diagnoses that I got, to be able to ask for resources, to be able to, kind of have a place to go. And with poppy seed health, the number one thing that I knew at the time was that doulas had saved me. And I made a commitment to myself to become a doula, and I did. I went through my first doula training as a birth doula when it was January of 2019. And since then, I've actually, boots on the ground with my own clients, so I can really understand their journey, understand our own maternal healthcare journey in the country, our own medical industrial complex. And I serve clients across a full spectrum. I'm also now a full spectrum doula, went through that training, and also lactation training. My point is that when I say it's parallel paths, everything that's happening to me, from that very first diagnosis, my very first loss in 2016, then the adenomyosis diagnosis a couple of years later, and then to my endometriosis diagnosis in 2020, everything that I've learned for myself, I've put into poppy seed health.
Love it. So I would love to know the history behind the name. So how did you come up with the name Poppy Seed?
Yeah, so I think every founder will go through this exercise. It is excruciating, by the way, to go through the exercise of trying to figure out the name for your company while also trying to own the domain for the name that you fall in love with, right? So I came up with Poppy Seed Health because of my very first loss in 2016. When I think about that fire that started to build in me, and it's just so vivid still in my memory, standing on the streets and, kind of being stopped in my tracks by, I was just pregnant and now I wasn't pregnant anymore, right? But this seed was planted in me within the first couple of days that whatever it is that I went through, and I again started to do a lot of research and realize that millions of people are going through the same journey. That seed was planted. And so poppy seed, the size of a poppy seed, in those, fun trackers that are out there, the size of an embryo at the very first stage of gestation, and viability is the size of a poppy seed, also the size of a raspberry seed, also the size of a mustard seed. But when you say poppy seed health, it kind of forces you to smile as well, saying the name poppy. And also, it signifies that we are with you from that very first stage throughout your entire journey for whatever you need.
Yes, I love it. And that's what I thought about too. I was like, she must be going back to the beginning of when embryos start to develop. And that's kind of the thought process when I saw the name. I was like, it has to be something around there.
That's right. You were totally right.
And so that's so cool. I absolutely love it. And I love what you do. So for those listeners who are listening or watching, how can they be involved with the application? So can you talk about how the individuals are connected with doulas and other professionals who are a part of the community?
Yes, no, absolutely. So, Poppy Seed is a venture-backed telehealth company. I am really proud to be one of the only Black women. I mean, we're not even in triple digits, I don't think. Maybe we are, but it's low. To have been invested in $1 million or more. Black women, just it is abysmal out there. But the one thing that I do know is that we've made Poppy Seed Health the most inclusive place for everyone to be seen and heard. So I do want to talk a bit about what that means for someone who is looking for emotional and mental health support, which is not a part of our global OBGYN or maternal healthcare system here in the US. And mental health care is healthcare. And it should be in points when you're out of your doctor's office, when you're in your doctor's office, when you're going through your milestones in your pregnancy and postpartum experience. And so we've created exactly that experience. So you can download the app. It's for free in Apple or the Google Play Store. And when you download the app, we ask you a couple of questions so that we can better serve you. Our secret sauce will always be in our matching algorithms. And so I want everyone to kind of think about any service that you use currently that is on demand. So think about your car service apps, right? Or think about your, groceries to your front door, like an Instacart. Think about your food delivery. All of those things happen within a certain amount of time, but they're on demand. They're at your fingertips. We did exactly the same thing with Poppy Seed Health because no one else was doing it in the birthing space. So someone would download our app, answer a couple of questions, and there's a big green button that says chat, right? And when you hit that button, within 90 seconds or less, we connect you with one of our advocates, a doula, midwife, or nurse. We cover every single time zone. So you could be, sitting in your home in California and a Poppy Seed Health advocate in Connecticut might pick up your chat, but that's in 90 seconds or less. The other thing, and this is very important to me and our mission and company, is when I talk about our matching algorithms, it allows us to be able to identify who you are because you've told us who you are and identify the best match for you. So the first thing that we decided to roll out with Poppy Seed Health with our matching algorithms is our miscarriage and loss hotline. It's a 24/7 text hotline. You do not have to be a member of Poppy. You can download the app, give us your first name and your pronoun, and then request a chat. And you're immediately put into a chat with someone, an advocate who is trained in holding space for loss and grief. We are not afraid to go to the ugly places with you. And what I realized is that there's a lot out there for these journeys, but there is really nothing out there for that one-on-one, private, secure conversation where you can just be yourself and get the support that you need. Everything that we do is text messaging, and people chuckle when I say that, but we tried everything else. And the truth is that people show up their most authentic and vulnerable selves, also out of convenience. If you're at work, you can text with someone from Poppy Seed Health. If you're on the train, if you're commuting, whatever it is, that's really important to us. So with our miscarriage and loss hotline, if you can imagine having experienced a miscarriage, going through a pregnancy loss, or even having one, which happens at Poppy, people have had pregnancy losses 15 years ago, 20 years ago, and had no one to talk to about it. And they are still grieving. So, so that's what we do at Poppy. That's the experience. And we think that it's really important for people to be able to get to an advocate that they feel really comfortable getting to. And similarly, when you order your car sharing app, your car sharing service, what you're doing is actually putting your trust in the company and the experience and the quality assurance, and the driver, but you're not getting the same driver every time. And so because of that, and for Poppy Seed Health to scale and really be able to address and support people across a full spectrum, we've put accessibility at the very core of our business. And accessibility for us means that we are building the most diverse and inclusive network of advocates. So if you are a Black woman like me, you can come to Poppy Seed Health and be connected with an advocate that mirrors who you identify with. If you are queer, you can come to Poppy Seed Health and be connected with someone who is queer. If you are on Medicaid, you can come to Poppy Seed Health. And as a part of our own business model, we actually take $2 from every member every month on their monthly subscription, and we are able to support people on Medicaid for free. We're very bold about that. And there are plenty of tech companies that actually have the same kind of model, Warby Parker with their glasses or Tom's with their shoes, but no one is doing it for the Medicaid population, the overlooked communities, the folks that wouldn't be able to have the same equitable telehealth connection and support. And they get absolutely nothing different on Poppy. They get the same exact support someone else would. And for our advocates, for our doulas, midwives, and nurses, they love Poppy Seed Health because they could be supporting someone who lives in a mansion in Beverly Hills while they're also simultaneously supporting someone who's experiencing housing insecurity. So that's the core of what we do at Poppy, but it's instantaneous. And when I say in 90 seconds or less, our actual weighted latency, meaning from the time you request a chat to the time someone picks it up, is within seconds, right? So as we grow, and as we continue to support the nearly 4 million folks in the US that will be giving birth annually, the nearly 1 million people that experience pregnancy loss and stillbirth, we know that there is a tremendous opportunity and also gap in the market for that emotional and mental health support that you need, that's supplemental to the care that you're getting as you go through your pregnancy and postpartum journeys. And that's just where we're starting, right? Pregnancy, postpartum, and loss. But there's so much, as you know, Erica, to the continuum of what that looks like for emotional and mental health support. So we're building very intentionally, but we are also building quickly and smartly.
Absolutely. I absolutely love it. Just downloaded the app myself. I was like, I need to be an advocate for pregnancy loss support.
Awesome.
So definitely for a lot of my doulas, I definitely will definitely offer that to them in our private community that we have so that
Great.
they can go and definitely join and be a support because most of them are full spectrum and many of them specialize in loss and bereavement. Are you all considering expanding to have more structured mental health support, like with licensed professionals that can be offered in the same manner?
Yeah, that's a great question. So I love that you bring up doulas, right? I have a really soft spot for doulas, being a doula myself, but being a newer doula, one of the things that I realized, I think early on is that it is nearly impossible to be a doula in this country, which is such a needed support, right? It should be automatically a part of your birth team, automatically a part of your support team, but it is not in the US. In many developed countries outside of the US, it is actually, but it's not here. And I think with my own perspective and with my new perspective, and learning that nearly 85% of all doulas in our country are not making a livable wage, and so therefore are not full-time doulas. I knew that there was this opportunity to tap into emotional and mental health support, but also the people that know all of the tips and tricks and holistic things that you can be doing at home, or with your partner or with your whoever your birthing team is, that are quite successful. And I think it's really important for us to be able to tap into the networks we already have with doulas. Same with midwives and with nurses. All of our advocates are trained, licensed, or certified. They go through a rigorous vetting process with Poppy Seed Health, but actually they've been trained and or certified and licensed not at Poppy Seed, right? So again, very similarly to how we think about tapping into kind of like the time asset of other mental health companies that really only focus on therapists. We've done the same thing with doulas, midwives, and nurses. I think to answer your question directly, I think we would consider it in the future. But there are a couple of things that are actually happening right now, which is dynamic for where we are, I think, at the intersection of what whole body compassionate care looks like, right? And that is, we don't have enough therapists to keep up with the demand. We also don't have enough providers. OBGYNs are at the top of that list to keep up with the birth rate demand either. But more importantly, and I think this is the most important actually, is the accessibility factor. Okay. So when we think about how we grow our advocate network and what that looks like for Poppy Seed Health, we are a product first, feedback first company. So we learn best from what our members need and what our advocates need and the feedback that they're giving us. The feedback that they're giving us doesn't necessarily align at the moment with actually having therapists. It aligns at the moment, though, with not having access to doulas because they may live in one of our maternal healthcare deserts in our country, which is over 1,000 counties across the country. That means people live 90 minutes or more from their closest provider, clinic, or hospital. So keep that in mind. Although telehealth and telemedicine and digital and virtual health has made it more accessible for people, plenty of folks don't accept Medicaid. 46% of all of our births in the US today are on Medicaid, and it's projected that in the next decade or so, that's going to look more like 50-50. So when we think about how we expand our advocate network, I will tell you that for the foreseeable future, doulas, midwives, and nurses, lactation support, that's what's really in demand for us now. And you'd be really surprised that there are not as many people, or just very slightly, not that high of a percentage of actual medical questions that people are asking on Poppy, of which we cannot advise, right? We can't give answers to, but we can certainly help them navigate. So perhaps in the future, but for now, we're really focused on growing our doula, midwife, and nurse, our nurse supply for our members.
No, absolutely. And I definitely 100% agree with that. It's very difficult to find just the therapists in general who are competent, culturally competent,
That's
who
right.
specialize in maternal mental health conditions. It's few and far between. So I do understand the demand, but I also, obviously, as a doula myself and as a doula trainer and educator, I understand the importance of having that doula and that whole body support as people navigate that continuum of motherhood, because it's not, as you mentioned, yeah, it's a lot of things that happen prior to getting pregnant, but there's a lot of things that happen post pregnancy too, right? So we want to make sure that we're providing that support across that continuum, across that spectrum. And I love that Poppy Seed has the ability to reach these communities that are so marginalized. Something that I always have a passion for is, especially now during COVID, right? We still
Yeah.
have, there's still, it's been a shift in how, as a doula, you show up in those spaces, those sacred and intimate spaces. So being able to be able to provide that support at the, in an app or through text message, I think is a direct need that's needed there. And then it also allows people who are in rural communities who may not have that access to a doula or a midwife or a nurse or a lactation consultant to have them on demand right there. And they can ask questions and send pictures and do all of the things. So I absolutely love what you're doing. I 100% love it. I'm excited to support it and definitely push it out to my doulas to say, go get on this app, upload your documentation, put your references in, and join this community to help really go out and do this work, because we're already doing it. It's now we have the opportunity to broaden our scope of how many more people that we can serve and be of service to. So I absolutely love it. So I would love for you, Simmone, to just leave our listeners with some encouraging words. Those who may be going on similar journeys, navigating through fertility challenges, may not have their baby in their arms. What encouraging words can you leave with our listeners?
So it's something that I have to tell myself actually, as I lead a very fast growing scaling organization in company with Poppy Seed Health. I have to tell myself my mantra is you are worthy. And I know that it's so hard sometimes to see your worthiness when you have everything else that's going great in your life. And for me anyway, I love the work that I do. I very much am driven and unwavering and really, bold in building a solution and a telehealth company for truly for everyone that needs our support, and that needs access at the loneliest times in your own journey. And I think especially for our advocates as well, you said it, Erica, and it's kind of an internal mantra that we have with our advocates, and that is Poppy Seed Health is really an extension of doing the work you already love, right? So when all of those things are coming together, I still am sitting in the seat of infertility. I am still, healing from all of my surgeries that I've just had this year. I actually, on the day that we released the app, which was April 27th, 2021, we did that in the morning, and I was laying on the table in an OR, getting my first embryo implantation that unfortunately did not work. So I also had another loss this summer, and I took all of that energy and I took all of those things, and I have put it back into finding ways to know that this body is still worthy, and that I am still worthy, and that I am not here um, just dependent on my fertility journey, right? And that love that I give to myself is the same love that I need to be emanating out. I think the other thing for everyone listening out there is that, folks ask me, how do I feel? I'm literally in the business of hearing the most intimate, vulnerable stories from, at this point, thousands and thousands of people across the country. And it all has to do, so many folks think, with something that I don't have, right? But I will say this, it is a powerful personal North Star. If you don't have a personal, powerful North Star, I would sit down, have a few moments of silent reflection with yourself, and create one for yourself that doesn't include just having a baby. We are worthy nonetheless.
Absolutely love that we are worthy. That is such a mantra that you just need to put up on a sticky note on your microwave, your car, your mirror, your bathroom, that we are worthy and we are enough. I have so enjoyed talking to you, Simmone. Where can we connect with Poppy Seed? So go ahead and give us all the details. And then for those who may want to connect with you and follow you on your journey.
Sure. So, Poppy Seed Health, our website is actually great for resources. Poppy Seed Health, the app, is in both the Apple Store and also Google Play, so you can download for free there. Our Instagram is at Poppy Seed Health. And as we actually focus on October being Pregnancy and Infant Loss Awareness Month, we are and have produced several pieces of content which are great for you as an individual if you've gone through loss, for your loved ones to support, and also for your employer, which I know we didn't chat a lot about today, but that's a really, really big one, how to communicate with your employer. And there's a lot going on there these days with the Support for Loss Act and employers not treating loss as the same as bereavement. So there's a lot of work we have to do there. And on LinkedIn, I'm just Simmone Taitt on LinkedIn, and I do love connecting with folks. So, don't be shy. You can send me a message on LinkedIn or come through Poppy Seed Health, any of our channels. I will most likely see it.
Thank you so much, Simmone, for being on the podcast. And I'm excited to connect with you after this episode.
Sounds good. Thanks, Erica.